Hi, everyone. Welcome. It's a little after 7 o'clock here in Ann Arbor, Michigan, and this is the University of Michigan Mind Matters Addiction Seminar Series. Tonight, we're focusing on how to help a loved one who is battling addiction. And we'll probably wait about 3 or 4 minutes before formally starting. But thanks so much for joining, and we look forward to an in-depth discussion of this topic and a robust question and answer period at the end to talk about concerns you might have, questions you might have on this topic area. While we're waiting, I guess I can provide a little more background on the Mind Matters seminar series. This is something that we started during COVID, and it was undertaken as a way to hopefully improve the dialogue between the research and clinical communities at the University of Michigan. As you're probably aware, U of M has a robust research enterprise, but you may not know that addictions and substance use is one of those topic areas where there are a number of people who focus on substance-related research. And I'd guess that across the institution, there's 40 to 50 different people at any given time researching the topic of addiction. But many of us also work in a clinical setting, and we felt that there was kind of a divide or a gulf between the world of research and clinical. So what we're hoping to do with this seminar is share a bit more about the research that's the foundation for why we make the clinical recommendations that we do, why we structure care the way that we do. And so that this is an opportunity to go into a bit more depth about what's known about the topic area and focusing on, well, what does that mean in practical terms, in this case, for caring for a loved one. So as I mentioned, this is something we've been doing for about 2 years. We have run through 2 cycles of the same topics, and we probably will change it up next year. So please provide feedback. There'll be an email provided later on in the presentation. Let us know what you think. Let us know if there are other topic areas you'd like to see covered, or if there's kind of a level of depth or explanation that you feel like would be more useful or appropriate. So it's a few minutes after the hour. I think we can go ahead and get started. So I'll transition here to formally welcoming you to the Mind Matters Addiction Seminar Series. And I'm Mark Ilgen. I'm a professor here at the University of Michigan and director of the University of Michigan Addiction Treatment Services, or as we call it, UMATS. UMATS is located within the Rachel Upjohn building off Plymouth Road in Ann Arbor, Michigan, and it's part of the Addiction Center and the Department of Psychiatry here at U of M. And as I mentioned before, a core part of our mission is to integrate what we know from research with the type of care that we provide, and to build our treatments around the best evidence that exists for treating substance use disorders. So with this seminar series, we're hoping to explain how we came to design care around the evidence and what that means for patients and their families. For tonight, we will have a couple, there are a couple housekeeping things I want to mention. The chat function in Zoom is actually disabled here, but the Q&A function is active, and we really encourage you to submit questions throughout the seminar series. So don't feel like you need to wait till the end. Put them in the Q&A. They will be visible to us, but not to the other attendees. We'll go through those at the end of the session. Also, a recording is being made of this seminar, and it'll be available to everyone as soon as the seminar is over. For today's speaker, I'm really pleased to welcome Dr. Joanna Quigley, who's the Medical Director of Child and Adolescent Ambulatory Psychiatry for both the Department of Psychiatry and for UMATS. As a child and adolescent specialist, Dr. Quigley has extensive expertise in neurodevelopmental disorders, addiction and substance use, and general mental health disorders and therapy. Dr. Quigley received her medical degree at the University of Nebraska College of Medicine and went on to complete a triple board residency in general pediatrics, general psychiatry, and child and adolescent psychiatry from the University of Kentucky College of Medicine. I can say on a personal level, I'm always impressed by Dr. Quigley's ability to understand what patients are going through, understand their symptoms and treatment options for them, but also knowing the context that they live in and how that influences how they're feeling. And so I think she's really an ideal speaker to talk with us on this topic about what we can all do to support people who are struggling with substance use. So with that, Dr. Quigley, thanks so much for joining us.
Thank you, Mark, and thanks to everybody who's joined us today. It's great to be here and have some time to talk about this with everybody. And let's just hope my slides advance. There. All right. So we're going to use slides to kind of orient everybody to this brief presentation. And then, as was mentioned before, have a lot more time to kind of have a conversation and talk with each other further as people have questions or other topics they may want to bring up. So one thing that I just want to start with is acknowledging that when you have someone in your life who's struggling with a substance use problem, maybe it hasn't even been defined as a disorder or been labeled as, quote, an addiction yet, it can feel really chaotic. And that it's just hard to kind of get your arms around how to think about it, how to feel about it, and then what to do. Lots of people sort of turn to maybe problem solving or trying to be really concrete about what might be helpful. I apologize, my slides are doing their own thing. So we just have a few things here to kind of frame that for everybody here listening. So one aspect of this, as someone who's involved or associated with somebody who might be struggling, is to create some grounding, a framework for yourself about thinking about it by kind of being more informed yourself. So maybe the person in your life is dismissing concerns by others, including you, or they don't notice the negative impact their use is having yet, and they're just not there and not ready. So it's always helpful to have information, have resources available when that person maybe hits that low moment or is in the emergency room with you because something has happened, or is really finally opening up to you about what's going on. And so, we'll talk more about resources later, but kind of having an understanding by doing some research yourself, or maybe talking to your own primary care doctor or your own friends about, when you've taken care of patients like this, or if you've known folks struggling like this, are there places that you went to that you would trust? How would I even tell someone to look for an AA program and things like that? So getting more information to have in your own toolbox, both for yourself, but for the person you're concerned about, can be extremely helpful. And just, as I said, be kind of grounding to feel like you're doing, quote, something, even when that person isn't ready to do anything yet. Related to that, and more specific to having a loved one who might be struggling with opioid use, would be learning about Narcan. So that's the medicine that bystanders, emergency medical services, physicians, the ER, everybody has been talking about, and you've heard about a lot in the news. So it's a medicine, for example, that you can give very quickly and easily through a nasal spray. And availability of it has become much more easy over time. It still can require a prescription. There are some areas in the country where it is becoming more easy to access without a prescription. But You can take a little brief course in understanding how to administer it. There's a lot of very good resources online and videos that you can watch. But if you feel that, if at least I know that Narcan is in my purse or it's in the house and I know how to give it to them, it can help you feel like there's something that you can do even while you're witnessing your loved one really struggle and be close to a crisis point. A lot of people still deal with tremendous stigma around acknowledging addiction or substance use that's problematic, and really feel kind of ashamed of having to think about it or see it in those around them. And I think one way to destigmatize is also to learn and understand a little bit more about what is going on for that person who is more vulnerable to developing a substance use disorder and an addiction. So, we do know quite a bit about what those risk factors might be. We wish we had more effective tools on the other end, and we have a lot of really effective tools, but as everybody knows, we don't have slam dunk drugs for every single type of substance use disorder, but we do know factors that might cause a person to be more at risk. And understanding that, I think, can help with our empathy and compassion for those who are struggling. So, there are risks on a very neurobiological level and a hereditary level. So in other words, our genetics. So we know that someone who has family members, particularly immediate family members who have struggled with an addiction or substance use disorder, are at higher risk for developing one over their life course. Other risk factors could be if a person dealt with a significant trauma in their life course, whether it was in childhood or not. If they struggled with homelessness, or if they were an individual who struggled with a sexual minority identity, we know that the inherent traumas associated with that are a risk factor for substance use and developing a substance use disorder or addiction. We know that for those who might start using at an earlier or younger age, whether it's alcohol or cigarettes or cannabis, what have you, the earlier you start using and the more you're using or the heavier your use is, the greater your risk is for a substance use disorder in adulthood. So maybe somebody who, for example, used quite a bit of alcohol in high school and was able to kind of party and binge drink on the weekends, but kept it together and maybe kind of got through college okay with a similar pattern, but continues that use into adulthood and deals with a significant loss or trauma, can very easily or more easily shift into developing a substance use disorder that meets criteria for being at a severe level and what we think about with more typical addiction. So, understanding that as well as the risk factors associated with having another mental health disorder. So, for example, struggling with bipolar illness, struggling with severe depression, struggling with ADHD or untreated anxiety, particularly social anxiety, can be another risk factor in that puzzle piece, those puzzle pieces that go together to increase risk for developing a substance use disorder that becomes problematic and requires a lot of treatment. And the final point here on this slide is really that the more informed you feel about, maybe hearing about a trial, about a new intervention for patients who are dealing with a particular kind of substance use disorder, can be really helpful because, as we'll talk about later, someone who enters treatment will often need to enter treatment several times before achieving that goal for themselves of long-term sobriety. So as I just mentioned, being on this journey with someone in your life who's struggling can be very difficult. It can be very overwhelming. It can be frustrating. There are a lot of challenges oftentimes with trust and repairing relationships. So patience is really an important thing to keep kind of in your mind and to reinforce for yourself that this journey can be difficult with a lot of twists and turns. So we know that the rule rather than the exception for folks is that relapse is common. I was listening to a podcast recently that Matthew Perry has done, I think in concurrence with releasing his recent book about his own struggles with substance use and sobriety, which has involved multiple stays in residential and step-down care and outpatient care. And he's had the luxury of affording very, very intensive care. But, he talks about that himself in this podcast about how hard it has been for his family and for his loved ones to watch him do okay for a little while and then hit a bump in the road and be back and relapsing and back requiring another course of intensive care and treatment. So there is hope, even though it can feel very helpless to be around somebody who might be struggling and back kind of at a low point with their use. But people do achieve recovery. Being there as a champion when they do have a relapse and they can't see that hope and can't see that light can be very important, so that they know that they can re-engage, that, they can get back into care, that you can remind them that they've done this before, they've managed to do it, can be incredibly helpful, because self-esteem is something that can be a real challenge for folks who have struggled with a substance use disorder, where they are aware of how much they may have messed up or damaged relationships or missed out on opportunities in their educational life or their work life or with relationships and marriages, et cetera. So again, as much as you are able to without compromising your own mental health or well-being, kind of being that champion and standing by and saying, I believe in you and I know that you can go back and do this again. So this slide gets to what I was mentioning in the prior one, just about how to be that person who can be a support while also knowing that there's only so much that you can do. And this gets, I think, to a lot of what's been written about in the lay press about codependency and what happens in relationships or when you have someone in your life who's struggling with a substance use disorder and an addiction of some kind. That you can find yourself spinning your wheels trying to help them and feel like it's getting nowhere, or feel betrayed, or give them cash that one last time because they really needed to pay the rent, but then you learn that they were not able to complete that task and ended up buying something to use instead because they just couldn't get past the strong drive to use. So, first and foremost, as people use the cliche a lot, when you're on the airplane and you need to put the oxygen mask on, you put it on yourself first and then the person next to you. But you can't really offer good support and maintain the healthy boundaries that will help that person feel more confident themselves in their own recovery if you're not taking care of yourself. And doing that will mean different things for everybody, but it might mean for you that you make sure you're getting to yoga. It might mean that you are just being very mindful of your own exercise, your own connections with your own friends, your family members who are well, getting good sleep. It might mean that you need to seek out your own care and therapy so that you have your own resource to feel like you have someone to check in with and be brutally honest about what's going on with this person in your life, because it can be really hard to talk to other people. You may feel protective of that person or not want to disclose what's really going on because you don't want them to feel like you betrayed their trust, et cetera. And walking all of those lines can be really tough. So, I think this is something that evolves over time for people, depending on the other demands in their life. But it's really important to come back to, especially, like I said in the prior slide, when that person in your life relapses and struggles again, and you feel pulled into it again, that you really need to feel like you can take care of yourself and set limits and do what you can to be helpful, but not feel too pulled in. So, I got at this a little bit before with talking about trying to be a champion when you can. So, one thing that we talk about when we talk about behavioral interventions for those who might struggle with addiction or substance use disorders, is how to replace those incentives and the kind of buzz or the good feelings that someone might be getting out of their use, that we can help them feel that from other aspects of their life, from other activities. And, we are basically trying to acknowledge the fact that in some ways their reward system in their brain has kind of been hijacked by their substance of choice, right? So when they use, the brain gets really excited about that and it keeps driving that urge to keep using. But when we can notice that a person might be able to get to a place where they feel some of that urge, and they're able to do something else instead, like go on a walk or exercise or cook with you, or just even to say it out loud can be a really powerful moment. And the more that we can do as someone in their life to say, that's so great to see you do that, or I really noticed this, or I noticed how you were so helpful with so and so, or it meant a lot when you were able to take the time to take care of this for me. All of those things can be incredibly powerful. And I said, getting back to that, helping that person build back up some self-esteem and some agency, and being able to be involved in people's lives in positive ways, not just that person who's always calling for help. So, just to be mindful of that, and that a person in recovery is working with that, on that with the people that they're seeing professionally, but there are ways to be part of that kind of retraining or reorientation in their life, as someone who cares about them. And, I've said this already, but it is perfectly healthy and fine to set boundaries with someone in your life who is using and struggling. And, that obviously takes a whole range of, it's going to look different for everybody depending on whether you're living with this person. Are they someone who's a family member, but they are in another city and they're only calling you when they're in distress? So, the boundary setting is really going to be tailored to your own particular situation. But regardless, it is incredibly important, not only for you, but also, as I said before, for the person who is hopefully going to be on a path to healing and recovery and to care. Because sometimes when we think we're being really helpful, we actually are not helping that person see some of their consequences or see some of the negative impact of their use. And sometimes that only helps to foster continued use for a period of time. So examples we have on this slide, is that, just please don't text me if you're intoxicated, or if you call me and I can tell that your speech is slurred, I'm just going to have to say, I hope you're okay and that you're safe, but I'm going to have to hang up. And there can be even, bigger boundaries set. And I talk to a lot of families about this when I'm caring for adolescent patients. But, we have a firm rule in this house, there's no substances. So that means your friends can't come over here with vapes in their pockets. There's no alcohol or drugs to be brought in this house. And we just have a zero tolerance policy about that because we can't take that risk. And this is part of us keeping our household safe. I mentioned looking for cash or money before, and certainly that can be a very hard line to walk when you're worried about somebody's safety. You don't want them to become homeless or miss out on house repayments or, lose their car, etc. But, I think it's really important to step back and look at, okay, what is this money going to? Is there a way I can help this person maintain their housing without giving them cash directly? Because I know if I give them cash, it's going to be very difficult for them to not feel, not struggle with that urge to potentially contact someone who can get them something to use. And, they may have the best of intentions, but again, we're talking about a very, very powerful neurobiologic process that's been set up with that reward framework in their brain. And this can involve emotional boundaries too. I did want to say that. So saying, when you start shouting, when you're intoxicated at me, I can't communicate with you and I'm going to have to go stay at my friend's house. or, when you're like this, it's really scary for the kids. And these are the boundaries and expectations I need to set. Otherwise, the kids and I are going to have to go stay at grandma's until you're kind of ready to take the next step with your care. So some of these boundaries can feel really hard to set and really hard to enforce and very painful. And again, that goes back to really taking care of yourself and making sure you're getting the resources you need to take care and get the support so that you feel like you can make these hard decisions and follow through. So, I mentioned this, and one thing that I talk to families about is, the substance use disorder has even more power when we don't acknowledge it or talk about it elsewhere. So there can be a lot of secrets kept, or, around so and so, we don't talk about this, or telling kids or other family members, you can't let anyone else know about this. And it does take on more power, even though it might feel like you're protecting somebody, or you might feel ashamed of the fact that this is going on for the person that you love. But it does not only, the stigma not only isolates the person who's struggling, but it isolates their community and their family network. So, we really stress the importance of connecting with others, and whether you might do that through something like Al-Anon, which was originally set up for family members of those who struggled with alcohol use, but now has expanded to be a support network for family, family and friends of those who might struggle with any substance use disorder. So those are more formal. I know there's more informal platforms through Facebook, or a lot of communities will post through their rec centers or other forums. I'm sure Nextdoor and all these platforms have those group sharing abilities as well, to kind of let folks know that we're gathering as a support for each other, because we have family members who are struggling with opioid use or with repeated overdose, et cetera. And then, like I've mentioned several times, getting your own help and support. Maybe you're in a relationship with someone who is now struggling with a substance use disorder, and you grew up with a grandparent or a parent who also struggled. And it might be very triggering for you to bring up past traumas in the context of what's going on now in your life. And really taking care of yourself will help you make sort of more clear-minded and clear-hearted decisions about how you take care of that other person. And one thing that, was sort of felt to be common knowledge or common wisdom for a long time was like, people have substance use disorders, or they're addicted, and that's what's going on with them. And so we have to have this very kind of narrow view of how to think about it and take care of them. But, for example, with adolescents, what we talk about is comorbidity, or meaning like there's something else going on, like depression or anxiety or a mood disorder, is the rule rather than exception. And I would say that's true for adults as well. And when we ignore that or don't treat that part of what might be going on, we also know that individuals will enter treatment more often. They will be less successful in achieving sobriety, and they're also at risk for worse outcomes. And, a very scary outcome that we think about with both mental health and substance use disorders, of course, is unintentional overdose or intentional overdose as well. It's a real safety concern, because when you're intoxicated and you're also struggling with depression, you may be more likely to act on a feeling in that moment that nothing is going to get better, and if you have access to means ending your life. So it's really, really important, both from a prevention standpoint, so thinking about those risk factors that I talked about at the beginning of this slide set, but also intervention to make sure you're addressing everything that may be going on for a person. So we're trying to be comprehensive, to be holistic, and make sure we're not ignoring those other symptoms that can be contributing to and driving to the feeling that using is somehow taking care of things. So a common one we might hear about is, well, I can't stop using cannabis because it's treating my anxiety or it's helping me sleep. So, it's our job in our professional lives to really tease that out and understand what's going on, so we can make sure we're addressing everything as completely as we can. And I think the point here is really important too. So some people might be willing to go into their primary care doctor and talk about their depression much more easily than they would be to, say, walk into their primary care doctor and say, I think I've got a problem with pills. But that entering that door and establishing a relationship with a mental health care provider is very likely to lead over time to that disclosure and then concurrent care for substance use care. Um, so many of the programs now are going to be called dual diagnosis, and want to address both and understand that that's so important. But I think as someone who might be helping a person access care, it's really good to keep in the back of your mind. So that's the way we like to approach things at UMATS. And it also is helpful to remember this because your loved one may need several different types of providers. You know, they may need to see the therapist they've been seeing for a long time, but then also see their primary care doctor and check in about their medical health for their medical impacts of their use, and be seeing a substance use specialist who's a therapist, and then maybe seeing an addiction medicine doctor or an addiction psychiatrist who's really working with them very specifically on how to support with medications their mental health concerns and their substance use concerns. And then, I think when we think about safety in the context of being in someone's life, it really hits so many levels. So it may be really simple situation where you're very worried that they've overdosed, they are out of it, they don't respond to you, and you just need to be that person who calls 911 and doesn't worry about the fact that when the person's on the other side in ER and sobering up, they're going to be mad at you, but that's just what you have to do. We talk sometimes with our families about doing things like taking keys away or taking driving privileges away, for example, from the teenagers I take care of, because of the fact that they're not at a place where they're going to be sober when they're driving. But also that your own emotional safety may be at risk, and maybe you have to take a break from that relationship, or maybe ultimately that relationship needs to end because that person is not able to manage their substance use disorder and get care and manage their relapses, et cetera, while also being an active and healthy participant in that relationship. And for some folks, that means setting that boundary and ending that relationship for yourself because it's become too detrimental to your own health. So I just want to be mindful of time, but talk about specific approaches for kids and being somebody who's in their lives and trying to show healthy approaches to use. So when I say that, it's very much being mindful of what that might mean. So, for us culturally, alcohol use is accepted, and showing that you don't have to drink every time there's a family gathering or there's a party, or that, you moderate your drinking significantly is noticed by kids and is really important. Modeling, healthy relationships for yourself, doing a lot of activities that have nothing to do with alcohol or substances can be very important. And also setting expectations within your own family system or your own home and saying, when something is illegal, it's never going to be in this house and you can't use when it's illegal. Being open about the health impacts of a substance use disorder or alcohol use or nicotine or cannabis, and not hiding those. Just because you talk about it doesn't mean that a teenager is going to be more likely to then experiment. Education is powerful. And we know from data that kids look to their communities, whether it's their own parents or their church communities or their teachers. The adults in their lives have a huge impact on prevention and reducing their risk of developing substance use disorders when there are clear signals sent that when you're 15, using alcohol or using cannabis is not okay. So, setting those limits, setting those expectations, and if it's, someone's caught vaping at school and the school has consequences, following through with those and not trying to get the child out of it because it might be hard to deal with, or you're worried about their college application, right? So at this level too, setting boundaries, setting expectations, and then following through on consequences when it's appropriate can be really helpful in helping that developing brain, that child, that adolescent understand the impact these things have. And then, also working with children and adolescents on building up their social and emotional toolkit over time as they're growing up. So whether it's your own kids or kids in your life and you're having a bad day, like naming that and talking about it and saying, oh, I'm had a really long day at work, but it's great to see you, rather than saying I've had a really long day at work, I'm going to go pour myself a glass of wine. So modeling that coping, and then asking them about how they're doing, describing how they seem to be doing to you. You know what, I noticed that you look a little bit worried or sad, or I wonder if this is on your mind. Having plans with kids in your life or your own children around safety. So if you're in a situation where you're at a party and you're offered a drink or you're offered a hit of something, what are you going to do? Or who are you going to call when you don't feel like you can drive home with one of your friends who's high? Activities, being involved in meaningful sports, music, art, etc., things that make kids and adolescents feel like they're talented, like they have strengths, like they've got a connection and a community that matters to them and that cares about them is really, really important. And also, of course, staying connected to their community at school, their teachers, checking in and seeing how their friends are doing can be a really important thing to do to understand what might be going on and what might be in their environment. So we talked about the fact that there are lots of resources out there. Sometimes it can feel like it's really hard to access them, but starting with your home networks, with your primary care providers, et cetera, can be really helpful. And I'm just going to speak briefly about what we offer specifically at Michigan Medicine through the addiction treatment services at UMATS. So we see adolescents through adults, and there are consultations for therapy and behavioral interventions, for substance use, as well as medication evaluations and consultations. And we have really skilled social workers who are psychotherapists, psychology faculty who are psychotherapists, as well as psychiatrists who do work in addiction, as well as addiction medicine specialists. And we are a learning environment, so we have a number of residents and fellows who also work in our clinic. We will prescribe medications both to address substance use, for example, like Suboxone, or a psychiatric medication to address anxiety, depression, a bipolar disorder, etc. However, just because you're seen at our clinic, which is true of many clinics, doesn't mean that you have to go see a psychiatrist or addiction medicine doctor and get on medication if that's not what's indicated. And it's also important to note that most treatment centers will offer different types of care. So one-on-one therapy, group therapies, maybe even day treatment programs. I've addressed some of this, but really, you don't have to walk in the door saying, I know I have a substance use disorder and it's this kind of substance use disorder and this is how severe it is. That is absolutely not what needs to happen. Anyone who's wondering whether they might be struggling is very welcome to seek care, even if it's just that they want to make some changes and would like some support. Another thing that we do offer is support to parents, for example, of adolescents who are in our care, and family members as well. So try to be, again, holistic and understand that this impacts everybody in this person's life. And we take most major private insurances as well as Medicare. So we have the different modalities of treatment I talked about, and we have group treatment as well. And actually, some of our groups are virtual and some of them are now in person. So we would be happy to tell folks more about which ones of those are available if someone was interested in learning more details. And then we have a link here to the resources specific to our program. And as I said before, family and friends who are in that person's life can also access care and be involved in the treatment. And oftentimes there is a partner or a parent or someone who is heavily involved in that person's care, in order to help support them and know that you're with them on that journey. So certainly we really encourage that when folks are taken care of at UMATS. So I'm going to end there and loop back to Mark so we can start taking some of your questions and talk more.
Great, thank you, Joanna. Appreciate the presentation, and we have a number of questions. I'm going to do my best to get through them, and please, for those of you in the audience, continue to enter your questions into the Q&A, and we'll get through as many as we can. For the first question, I actually am going to combine two different issues that came up, but the first is about how to help the person you love understand what your concerns are. How do you have an impact? Usually, people with a substance use disorder have heard before that people have some concerns, but it's hard to engage them and help them understand it, and then see that translate into them wanting to receive care. And part of that, you mentioned praise, but it's, if on TV there are shows around interventions that seem very confrontational, and they almost seem like they're the opposite of praise, where you point out all the ways in which the person has created problems. Can you talk a little bit about that conversation you might have with a loved one around changing their substance use? How do you approach that? Where does praise fit in? How's that go?
Yes, I think it's really challenging, and it can be very overwhelming to even think about where to start, right? So I think that's probably why this question came up. You will still read online, particularly from treatment centers, about sort of the classic intervention of, 4 or 5 people in their life coming together and sitting down and saying, we've, X, Y, and Z is going on. This is not acceptable. You need to go to treatment. For a lot of people, this process might be a lot more organic. And I think trying to initiate those conversations with I statements can be really helpful. So sort of saying, I've noticed that you aren't wanting to go out as much anymore with our friends that we used to spend time with. I've noticed that you seem a lot more irritable lately, and I'm just wondering if there's something going on, or is there something I'm doing that we need to talk about? I was just reviewing our credit card statements, and I've noticed that you seem to be, going to whatever place it is, the bar, the restaurant, or a lot. And I'm just wondering why there's that change in your spending. I think some of it can come from humble inquiry, if it's a safe time in that person's life, that you can sort of start to say, I'm noticing these things, I'm wondering about them, and give that person the opportunity to maybe either reflect on it in the moment with you, or start to plant those seeds for that person, that other people really are paying attention, and this sort of flying under the radar that's addiction tends to make people feel they can do isn't working anymore, right? And as those conversations keep going, hopefully, or at least as you continue giving that feedback, you can say, I have talked to my friend, or, I've been thinking about this or reading about this, and I'm starting to be concerned that maybe your alcohol use has reached a point where I'm worried about your health. And here are some resources that I found out about, and I'm just going to email them to you. I'm going to leave them here on the coffee table, and just wondering if you would at least just think about it or look at it. It's really, really challenging, and it may reach a point where you have to go into their primary care visit with them and say, I'm really worried about your health, and we're reaching a point where I'm worried you're going to be in the hospital, or you might die, et cetera. And we know from the opioid use pandemic that these are not lighthearted conversations, and they're not easy ones, and there's real things at stake. So I don't know if that's the 100% slam dunk answer, but I think that engagement is the most important thing to really try and get someone to think about stuff.
That makes sense. One of the questions was really asking for some more specifics about types of treatment.
Mhm.
When we talk about substance use disorder treatment, are there certain labels or types or things to look for
Mhm.
when you're looking for an evidence-based treatment approach? Maybe both in terms of psychotherapy and medications.
Mhm.
What do you look for?
Right. So a lot of this may be driven by how significant your loved one's substance use is and what type of substance they're using. So, for example, your loved one may have reached a point with their alcohol use that they actually need to be in an inpatient medical setting to detox safely. So, to have a very controlled, with the use of medications, treatment, so that their body can be without the alcohol safely. Because we know when people use lots and lots of alcohol and they go into what we call acute withdrawal, so they stop that suddenly, they may be at risk, for example, of really scary seizures. So, you might actually be looking for something really intensive for your loved one like that. And that then from that intensive medical care, they're able to step into, say, a day treatment program where they're going to programming every day, or maybe they need a really longer term care, like a residential facility. Um, but when I think about how to explain substance use care, you can kind of start at that most intensive place and work your way down. But there are many, many layers to and options for care. So um, from that point, they may go to a day treatment program, for example, or they may need to actually be in a more sober living environment for a period of 6 months. Um, that day treatment program should include use of psychotherapy, individual therapy, group therapy, as well as work with a provider who is medically trained, and who can prescribe medications, for example, if they are needed. And then a person may step down to doing an intensive outpatient program where they're just going a couple of times a week to a program, as well as meeting their individual therapist, doing the group therapy involved in that intensive outpatient program, and seeing a doctor about their medications. Um, some people who maybe want to make initial change with their use and maybe don't meet criteria for a severe substance use disorder may be seeking care at the level of what we call outpatient care, right? So they might benefit from an evaluation with a specialty therapist who is trained in cognitive behavioral therapies as well as in evidence-based therapies, specifically for substance use disorders. And you're usually able to see people's credentialing, whether it's on Psychology Today or on the websites of the programs that you're looking at online. Um, and they should be referencing the fact that their interventions are based in best practice for substance use treatment. So, another thing you guys might read about is harm reduction models versus, you know, programs that want people to have absolutely no substance use. So, those are some different philosophies around care that people might be reading about as they look online.
Great, thanks. And can you talk a little bit more about Al-Anon? I think for family members, that is a resource that is often recommended and people have attended, or maybe their friends have recommended that they attend. Can you tell us a little bit about what to expect in terms of an experience with Al-Anon and how that fits in to supporting families?
Yeah, so it's an international organization. There are groups and meetings around the world, and um, they have a website, so it's actually quite easy to look up where those meetings are. So it is grounded kind of and similar to the grounding of AA insofar as it's a group setting and people talking about their experience with their loved one. It is supposed to be, confidential and a safe space for the family member to talk about how that loved one's use is impacting them. And there are some subspecialty groups. So there's the more, as I said, traditional Al-Anon that was started around family members of those struggling with alcohol use. But again, as you know, folks struggle with, for example, in the opioid pandemic, opioid use disorders, you likely can find Al-Anon groups that are more related to that experience. And there's also Alateen, and I've definitely recommended that to adolescents I've taken care of in a number of different contexts who might be dealing with a parent who's struggling with a substance use disorder, or an older sibling who's struggling with a substance use disorder. And it can be very helpful if that particular meeting and that particular group of folks is one that feels comfortable and safe. There are, of course, lots of other ways to find support, as I mentioned. And some of those Al-Anon groups and 12-step groups might be tied to, example, thinking about where we are in Ann Arbor, an institution like university. So sometimes that's another way to access community-specific groups.
Great. And we probably have time for one or maybe two more questions, but one here is just asking about the impact of substance use on development. I'm assuming like emotional, personal development, pointing out that for a lot of people, their use either begins or certainly intensifies during adolescence.
Mm-hmm.
And then even for people who are in their 40s or 50s, they almost seem stuck in an adolescent role. Is that common, that there's this kind of, it feels developmentally like it's working with someone who's younger? And then does that ever change if someone is older and they missed out on maybe a traditional adolescence because they were using? Are they, is there the potential for growth as they're older, or are they really going to be in that role for the rest of their lives?
Yeah. So, I mean, to answer the second part first, and you kind of framed it this way, Mark, but yes, absolutely, there's hope for change and growth no matter what age a person is at. And I think it can be really hard to think that that can happen, but with the right supports, with the right therapy, with the right relationships, and right is the wrong word, with the kind of relationships in their life at the stage when they're ready to make that change that helps foster that, it absolutely can happen. What we understand about the brain is, probably 30% of what we'll someday understand. But what we do know about what goes on with adolescent development is that the adolescent brain goes through these profound changes through the teenage years, well into our early 20s. Okay, so there's all of these connections being made. There's kind of this cleanup going on in our brain to really make this a very fine-tuned machine that's going to operate and function really well in adulthood. And so when you have exposure to substances, particularly at any significant level during this really precious time, you can either redirect that cleanup process or kind of put on pause some of the normal maturation and development that would be going on for the brain during that time. And it really can affect kind of the wiring of how a person processes things. There's really interesting research about, for example, how a person who may struggle with use during that time and into their early 20s might misread emotional cues and, might not understand how to pick up on sadness or happiness, or even be able to develop some of those tools around empathy because of their substance use and the impact it's having on their brain development. So again, going back to those slides about kind of education and understanding, maybe helping us be more compassionate. I think, when we can remind ourselves of that, even when it's really hard to deal with someone and their behaviors, it can at least help us understand things a bit better. And it does impact executive functioning, right? So that person's ability to pause, be able to make better decisions, be able to sort through information in an organized way, et cetera. When you have use going on during those adolescent years, it can affect their ability to go through the normal stages of developing better executive functioning.
Great. I'm going to try to squeeze in one last question here. When people are actively using substances, they sometimes shut out their loved ones. They don't respond. They don't return text calls. Do you have any suggestions for the loved one? How do you respond to that? Obviously, a message is being sent, but you also want to be able to have it be a two-way message. Do you have any suggestions for those sorts of situations?
Yeah, I think it can be very, very painful, and just acknowledging that and seeking out support for yourself, and the fact that you are being blocked out, I think is important. If you have the energy and the emotional resources to reach out in other ways, I think that can be effective, even if it's writing a note that says, you know, you haven't responded to my texts. I'm a little bit worried about you. I'm thinking about you and I hope you're doing okay. Can go a long way. Or asking, um, maybe they don't respond to your texts about how they're doing, but they're willing to go on a walk for you or go watch the football game and do some other activity. So if there's other ways to stay connected, even if they're not ready to talk to you about what's going on and the nitty gritty, it does still matter. It helps with that loneliness and isolation that's going on for that person who's struggling with their use. So
Wonderful. That's very helpful. Thank you. I think we're close to the hour here. We'll probably go ahead and wrap up. I hope all of you in the audience found this helpful. Thank you for the insightful and thoughtful questions. And we've provided some links in the chat. You can see an email address there. You can always email us with other questions, and also with suggestions or feedback for how we can within the U of M, provide you with more useful resources or tools or educational materials. We're very eager to think about how we could be more engaged in that process. I want to just make sure I acknowledge and thank the support that we receive for this educational series from the Patrick Gibbon Memorial Fund. If any of you know Dr. Gibbon, he was very active in the recovery community here in Ann Arbor and supported hundreds or thousands of local members of our community in making changes and supporting their recovery. And he was a wonderful member of our community, and he's certainly missed, and his support helps fund initiatives like this to help us better engage with the community. So I want to acknowledge Dr. Gibbons and thank him for his support. Thank you, Dr. Quigley, and thank you everyone for attending. Take care.